Welcome to Mint. In this edition of From the Newsroom, we are joined by Vidya Krishnan. Welcome to the show, Vidya.
Thank you.
Today we are discussing how one of the flagship programs of the Congress party-led UPA, which is the universal health coverage, might go to the back burner owing to a lack of money. Vidya, what is the debate about?
The universal health coverage was supposed to be the government's flagship program in the 12th five-year plan, under which they were going to expand the entitlement regime like they did with Sarva Shiksha Abhiyan, right to education, and then right to employment with Narega. Only in this case, the public health reforms that are a part of implementing universal health coverage require a minimum of 2.5% of the GDP, which the Prime Minister had promised last year. When the 12th five-year plan was finalized and approved by the National Development Council, it was the allocation to Health Ministry was around 1.85%, which is highly insufficient. And the Health Ministry has been very unhappy about budgetary allocation, and which has led to the differences between the Planning Commission and the Health Ministry to implement the program.
So where does in all this, where does the Planning Commission figure, and what are you hearing from them? What are they saying?
From highly placed sources within the Planning Commission are actually say the exact opposite of what the Health Ministry is saying. What they maintain is that the issue is not about the money or the lack of it. It's about what you do with the limited money that you have. And health being a state subject, all the plans, including UHC, cannot be implemented at a central level. They will all have to be implemented at state level. So what the Planning Commission is saying is that while we agree that there is limited money, the Health Ministry should already be speaking with state governments and start to chalk out pilot projects at district level. But like all ministries, Health Ministry is saying they cannot do any of it without the central purse, with a big envelope coming from the center to, especially to states that are not doing very well.
On the front of the UHC.
Yeah.
So tell me, where do you see this going? Do you see this being resolved anytime soon?
What is certain is that for now, universal health coverage is going to be implemented at one district in every state, instead of what we were expecting, which would be an all nation, that it would be available for every citizen in the country. So once the districts are finalized, the biggest concern here among civil society organizations is that the states that are doing poorly, which need the money the most to implement health reforms, will suffer the most, because the states that are better off will implement the project better, the pilot projects will be better, and the outcomes will be better. But without central backing, people where reforms are needed the most, there will be no help from center at all.
So we can say that as of now, UHC is not really taking off in the near
not within the next 2 or 3 plan periods.
Thank you for joining us today, Vidya.
Thank you.
This is from today's edition of From the Newsroom. Stay tuned and keep watching for more.